Welcome to episode 7 of Dr. Hatz blog, Insights of a Clinician CEO. In this episode, we're talking about artificial intelligence, but in particular, ambient voice technology. This is a big part of the NHS 10-year plan, and we've been doing a lot of work in this space for a period of time, in particular with Surrey Heartlands, the health system in Surrey. About a year ago, we prioritised AI with the health system, and we decided to do this in a way of bringing together key stakeholders across the system, up to 50 people, which included executives within the health system, to healthcare professionals, and also industry partners who are developing technology in this space, and to think about how AI was going to affect the system in the future, but to also make sure that if we're going to use AI, we've got to do it safely. So it has to have the right governance, it has to be integrated with the health system and some of the technology that it already uses. It needs to be safe and secure. And so by bringing the right stakeholders around the table, we co-design and work together on this. So in this episode, we reflect on that. And I spent some time with George Anibaba, our Senior Innovation Manager, and Jo Wookey, our Senior Program Manager, to talk through what we've been doing with the Surrey AI Roundtables and some of the learning from it. What are the key takeaways for you from the work?
One of the things that we could sense in the room is that there is a will to transform the lives of the people we serve and those who serve them by using a tool like AI.
We acknowledge where the issues might be, where some of the challenges might be, but actually being able to get excited and see how this is going to benefit staff, how it's going to benefit patients, and actually have a way to do that, and actually think more positively about implementing something, given some of the challenges previously of any new systems can be challenging, and actually taking those lessons learned has been really, really helpful.
Building trust is something that has been highlighted across the board and the forum and the group of stakeholders that we've had. So how do we assure the populations, the people that we serve, that this solution is there actually to improve their experience of care, to improve the outcomes that they'll experience as well?
I think the big takeaway is just getting the right people in the room and actually having the conversation and everyone saying, well, actually, I don't know that much about it. What can we do? And actually, once you start at that point, then everyone was really open and honest, and we were able to start to find a way through.
What even the future of AI holds for Surrey and wider?
So the future really is as big and as bright and as hopeful as we want it to be, again, depending on our risk appetite. So it's just about having those guardrails and the safeguards without stifling the potential future and the art of the possible.
One of the things we saw in the first roundtable, people talked about actually solving this from a problem perspective. So, that doesn't change. And whenever I think about AI, where we are now, we're very much on that. How do we use this for tool for good? Wonderful to catch up with Jo and George on those Surrey AI roundtables. I found them fascinating, particularly actually having industry colleagues around the table, for example, not to sell their product, but to help us work through how we get this technology adopted at scale and develop the right business case for it. But also to have lay representation and academic partners to think through some of the challenges like sustainability and how AI might affect our future from that perspective. Do read our case study on what we've been doing in this space. We're always keen to share some of our learning, but it's really core to what we do at Health Innovation Kent Surrey Sussex in terms of discovery, co-design, and then the implementation of innovation. We'll also share with this video some of the guidance around the use of ambient voice technology, so you can read this in your own time. So thank you for watching. As ever, get in touch to find out more about our work, and please do provide any feedback or comments if you found this video useful.